So, good evening from everyone from Italy, and buenos dias to all friends in Guatemala, and welcome to this new appointment to COVID-19 global talking all around the world. Tonight, we'll have the chance to have a great host from Guatemala. His name is Dario, so just welcoming him in the stream.
Hey
And
Pierre.
Dario, how are you?
Good, thank you. How you doing?
So I want to say buenos dias. I try also to learn a bit of Spanish, so even the friends from Guatemala cannot understand me. Of course, they know English, but I want to learn Spanish. It's a wonderful, it's a wonderful
That's a good
language.
idea.
So, how is the situation in Guatemala City? How it is? Is it hot now? Is what's the weather now? Just a quick overview.
Yeah, well, actually, we're entering to it's weird. Our weather, it's changing all the time. So it's usually winter in the morning, summer in the at noon, and probably like fall in the afternoon. But right now, we're at the summer-ish, like
Right.
getting to the rainy season. So it's pretty
So
cool right now.
So, in Rome actually is a spring situation, spring weather, and we were very happy to get out from to enjoy our spring. And luckily, maybe on the 4th of May, we'll be very happy to have our phase number two. So, because actually, as you know, in Italy, we are all landlocked and from among 40, 45 days, more or less. And of course, we are thrilled to go out and at least using the mask and everything enjoying the life. I don't want to waste your time with my little things from Rome, but I want to get inside because uh, Dario, I had the chance to meet him in United States of America from this IVLP project, and that we make it together. And of course, I found a great friend in Dario, and I know you are very involved in your job as NGO and in other activities. So, what is the situation now in Guatemala for coronavirus?
Well, actually, we right now are not at the very worst situation yet. We have less than 300 cases, and we were notified yesterday. We have 11 deaths for coronavirus. Right now, we have three different hospitals, temporary hospitals that have been built for coronavirus. Actually, what the government is doing is to provide some temporary hospitals so we can put all the people with coronavirus over there so we don't use the regular hospitals and avoid spreading to another sick people this disease. So that's how they're containing. Also taking some other measures to avoid people contact. So we have a partial lockdown. We can go out from 4 a.m. to 6 p.m., but then we're locked down at our houses. And we also need to wear masks to go out and take all the precautions to avoid spreading the virus. A lot of uh, business are closed right now, especially the ones that had to do with getting people together. We're not allowed to get many people together, and the business that are open, they have to be sure that people it's keeping distance from each other so we avoid the spreading of the virus right now. We as I told you, we still don't have a huge amount of cases, but it's expected that within the next few weeks we will increase this number and we get to the highest peak of this disease.
Right. So actually, the social distancing it depends from all around the world because, in my experience, Italians, but I think in general Spanish, Latino, you guys like to dance. We try to dance like
Yeah.
you, but we are not able because you are very good dance. So the social distancing, be distance from another people for us, as you know, it's very difficult. So because we like to really stay in contact with each other. But of course, is one of the most important measures that we have to take to avoid the spreading of this coronavirus, including the usage of masks. Before going inside your job, your activity, I just want to read your bio so everyone can know what you are doing, the important job. You have really a long bio, but of course I will read we can say the most important things. So from Guatemala, 30 years old, is a biological chemist degree from San Carlos University with a degree on comprehensive care for HIV, microbiology from Roosevelt Hospital, and internship at STI Specialized Clinic on La Condesa, Mexico City, and actually studying a degree on molecular biology. And he worked, of course, as pharmaceutical companies, research department, into university, in the sexual health NGO called CAS, where actually he is in charge of the laboratory diagnosis and one of technical advisor. So you actually also work for CAS, this NGO that you are talking about. You want to explain a bit what is the activity of CAS and what is your main activity?
Yeah. Actually, we started as a community-based clinic for gay and bisexual people at Guatemala City. We don't have specialized clinic for STIs, and not a lot of places you can go and get treated for those diseases, especially HIV. We have a lot of stigma on this topic. So what we do is we provide test and diagnosis for HIV and STI, so we can help people who is going through this situation to get like the medical attention that they need. We started like as a small clinic. Now it's growing. We still have like very few people, but it's growing more and more. And now we have around 6,000 attentions per year. And we're one of the clinics with the highest HIV diagnosis in Guatemala. We work together with the biggest hospitals in Guatemala, also with the Ministry of Health and the Pan American Health Organization, that is the UN organization in charge of health in this region, that it's called PAHO. And actually, I wanted to show a quick video that we did with them a couple of years ago.
Okay.
It's gonna talk a little bit about the CAS work. Probably it's not gonna be the entire video, but just to let you know what we do. It's in Spanish.
It's very important. Let's see this
So
video.
Que por medio de las redes sociales se acercan a CAS. Hay población a la que nosotros le llamamos población oculta. O sea, son esos perfiles en Facebook que son perfiles de personas gays que no muestran un rostro por confidencialidad, por miedo y ese tipo de situaciones.
Te presentas primero que nada como su amigo, no como un doctor o un médico que les va a obligar o que se sientan presionados a asistir a nuestros servicios a la clínica. En Grindr, pues netamente toda la población que está ahí utilizando la aplicación es 100% gay. Eso te garantiza de que la cantidad de población que estás acaparando es netamente de la comunidad.
Lamentablemente, cuando uno se va a hacer las pruebas de VIH, a uno lo señalan. Creo que por eso es que la mayoría de gente prefiere no hacerlo. Entonces, lo que me agradó de CAS fue que me recibieron muy bien, a los demás pacientes, pues a uno lo tratan, hay mucha confidencialidad, mucho cariño, no importando si uno es trans, si uno es gay, si uno es bisexual, etc.
Nuestra idea es tener horarios extendidos, horarios flexibles para nuestra población. Nuestra clínica inicia a las 3 de la tarde, termina hasta las 8:30 de la noche.
El servicio que nosotros ofrecemos de pruebas comunitarias. Si usted necesita la prueba y no puede venir a casa, nosotros se la llevamos a su casa, se la llevamos a su trabajo, se la llevamos al lugar que usted nos indique y a la hora que usted nos indique, el día que usted nos indique.
El servicio que ofrece la unidad móvil de CAS es prácticamente una evaluación completa. Eso incluye prueba de VIH, prueba de sífilis y un chequeo médico de infecciones de transmisión sexual.
Y eso crea una gran diferencia en la respuesta, porque no estamos atendiendo en base a nuestras necesidades, sino en base a las necesidades de la población.
So very
Yeah, I think
interesting. This,
I will stop it there.
of course, let me remind you, and of course, if you wanted to say in Spanish, of course, that our guests that are following the live, they can make questions, and of course, I will publish in the screen so everybody can see the question, and of course, we can answer together to this question. So that's it.
Yeah, si alguien que está viendo tiene alguna pregunta en inglés o en español, puede hacerla y nosotros vamos a contestar esas preguntas. Yeah, just to also add to this video, we started as a gay clinic, a gay bisexual clinic. Now it's open to everyone who actually needs it. We don't have many places in our city to go and get treated for these diseases. And if you go to a public hospital or a private hospital, you might get some kind of discrimination because of the topic. It's very taboo.
Yeah.
So we try to make it like comfortable for the people.
Exactly. This is a very important message, Dario, that we have to learn. We don't have make distinction because, of course, the respect of all genders all around the world must be something that we must all defend all together. So no one, this is a very important message that you sent to us with the CAPS work that you are making in Guatemala. No discrimination of all genders. So we are fighting all together to make it this clear, and it never happened that people from all gender feel discriminated. So this is a very important fight that you are dealing with your activity. But I also know that close to these very important topics that you are dealing with, you also making, you are involved in a COVID-19 directly. What is your activity now?
Yeah, I'm actually part of one of the healthcare teams at the temporary hospital at Guatemala City. At one of this hospital that was built for attention of COVID. I'm working at the laboratory and diagnostic team. So we help the people with diagnosis and the all laboratory follow up. So we can make sure that the treatment it's the correct one, and how they're like evolving during this situation. So yeah, that's one of the jobs that I also do, and it helps me to give just a little bit of something to Guatemala with this situation. I mean, like we work a lot in other topics, but this is something that that also helps because there were not this much people willing to work at the very beginning. It's and it's something that we understand. Like I'm a single person right now that can afford that. I'm not someone on risk on my house, so
Yeah.
it's responsible that way that I can do it without putting anyone else on risk.
Yes. So of course the fighting against coronavirus, but in general the discrimination linked to the disease when people get in touch, unfortunately, with the diseases, he fight, of course, a great war, a great challenge against the disease, and the stigma. This is the word that really touched me when you, in the last days, you told me about this stigma. So what is the sensation? What is the feeling that you can talk about it?
Well, the misinformation, it's been a problem right now with the people. A lot of people, there are many theories about the virus. Like I am not an expert on the virus, and there are very few people who can say that right now because it's a very new virus. So
Yeah.
even we're working with that, it's hard to understand yet how it's going to behave, because even the scientific research is showing us that we just don't know enough about the virus. So, but people, it's creating a lot of myths. And you can see at the World Health Organization websites that they have to clarify things like the virus is not spreading through the phone waves, or that alcohol, like drinking alcohol, is not gonna keep you safe from the virus. So there are a lot of theories about the virus that is people making people really scared. So when someone gets diagnosed, the government has asked us to not share any of the information about the people, because some of them are getting attacked by other
Yeah.
people. Like they're just scared and they're attacking people. They're attacking also health workers, because
Right.
they think they see us like
An
a
enemy.
yeah, so it's being kind of complicated. We're trying to educate the people actually. If I can show you something, and
Yes.
CAS is one of the works that we're doing right now. The website, if you go to the social media, you will
Yep.
find some information about COVID and how to respond to that, especially if you're having like any emotional impact on that. Well, it's something that we are sharing ideas of how to help with that, but also we're trying to to provide some information to help uh, other workers to do their job. Here you can see some of the information that we share on the website, on
Very
at the
important.
social media. Yeah, like how to behave with people too, like be nice, avoid the stigma, talk with people, keep social distancing, how to wear a mask, because right now there's a lot of people wearing masks, but they don't actually know how to use it.
Right.
So
Do you have some information that you can show us? Okay.
yeah,
You want to show some picture how to wear the mask, so we, or just
yeah,
to
yeah,
give
I'm
the
not sure.
information?
Yeah,
Of course.
I'm gonna show you.
And if, in the meantime, I can talk to you about, of course, the usage of the mask. And in the meantime, Dario will, of course, looking for something. The why is important to wear a mask, because if you have the coronavirus and you are a positive in the coronavirus, you avoid to spread to other people. And this is very important because many of us, especially young generation, not me because unfortunately I'm not too young, but in general, if you are asymptomatic, so you don't have nothing, you don't see nothing, even if you have the virus, you can spread the virus without using the mask. So the usage of the mask is a very important, Dario, and you are great. You're doing a great job in the hospital. I'm sure that you are working so hard to this. So let's see this
I
important
think,
information on the mask.
yeah, I hope, I'm not sure if I'm sharing it right now. Is it on
Yes,
screen?
yeah,
Okay,
perfectly.
so
We saw it. Let's comment. Yeah.
yeah, this is some of the information that we post on Facebook. All information that CAS is posting on the website is based on the on international guides from CDC, from PAHO, from other organizations. Everything is based on evidence, so we can make sure that information is not a myth and it's not something that we are not so sure about. So we're sharing information like this of how to wear it, what to do, how to avoid, and some other advices are posted on our websites, so we can have ideas of how to control anxiety, depression, and actually one of the other things that like we post things like this, how
Yes,
to protect ourselves and our emotions
this is
during
very
the
important.
quarantine. So we have a very good psychology team at the organization. So they help us to prepare some information about what things we could do to keep ourselves healthy, not just physically, but also emotionally. So this is some of the information that we're providing. We're also providing distance help. We have psychologists and physicians who are willing to assist people through the phone or through text messages or phone calls or video chats, so we can assure that the people, because right now everything is COVID, but there are other diseases that are still with us, like the rest of the health system is continuing. So we have to make sure that people can receive the help that they need for other things too. So we're trying to help with that. We also, and that helps the people to make sure that life continues, that this is something that is going to be part of our lives now, and we have to continue going on, and which ways we can do it in a healthy and responsible way. So yeah, that we have a big, well, not so big, but like a great team. This is some of them.
Oh,
But we have a kind of small team, but who does like miracles and marvelous things. There are some of them who are missing in this picture, but we do have a lot of people that's committed to help the population, and we do work on HIV and STIs, but we're right now putting all our effort
wow.
to work in everything that Guatemala population might need. So if someone needs a psychologist, they just get in touch with the phone numbers that we gave, or through the website or the social media, and we will have a psychologist to assist them. We will have physicians to give some advices, and we're right now working in a way to can receive people in the clinic to be able to give a personal or presential attention with all the measures that can protect our personal and our patients too. So
Right.
are some of the jobs right now.
So, dear Dario, we are in a closing phase of our interview because we want to make it shortly, effectively, without wasting time. Can you leave us with some tips, advices for coronavirus, and of course also the HIV prevention? Because I think now maybe we can concentrate on coronavirus. Of course, it's very important, but from the other side, we can never forget the HIV/AIDS prevention. I think that maybe we forgot a bit about the HIV prevention, and this is a very important issue.
Yeah, well, we can remember that HIV it's also a pandemic, so we do have HIV everywhere. We have some advices for people living with HIV, so they can make sure that they continue having their medication. That's something very important. Do not stop taking medication. Be sure of being in touch with your healthcare provider so you can have appointments. And if it's necessary, just go and get the medication. If it's necessary, go and get a physician appointment. But also remember that the people who works on HIV, we know that this is something that we have been through, the stigma, discrimination, and all the fear about a disease, but not everybody is aware of that. So I think it's a time to be empathetic, to recognize that we need each other, that we need to help each other, and that we need to inform right now. And if I don't know, that's okay. But I need to find out someone or somewhere that it's confident. So I will suggest the people to avoid panic, to keep well informed, just the right amount, just what you need. You don't have to be all the time, all day thinking about COVID, because that's gonna take your life away. You have to continue with your life in a responsible way, and looking for a good information based on evidence, like scientific evidence. That is very, very important.
Of course. So if they want to contact you or your NGO, there's of course the Facebook. They're showing it. There's a website that everybody can see on the bottom of the pages. And as they're reading from a comments from the public is very important. I showed it before. I want to show it again. There is a lot. One Fernando Solaman, perdóname por my pronunciation. So there's a lot of prejudice towards COVID-19. People tend to spread stigma and misinformation. And this is a thing that we have definitely fight all together from all around the world. So thank you so much, Dario, for being here today. A big up from Italy with social distancing, of course, to Guatemala. And of course, we are all connected. This is my most important sentence to say. So, gracias, muchas gracias. Hasta luego.
Ciao, Pierre. Gracias.
Have a nice day. Have a nice day. Thank you for joining us, and see you tomorrow for another interview from Tunisia. Thank you.
Thank you. Bye.
Ciao, Dario. Bye.
Ciao.